So there are some trials have been done in this area where they have combined targeted therapy like Perjeta, Pertuzumab, and Trastuzumab. These are anti-HER2 drugs along with chemotherapy, and they have done a comparison to understand those patients who received only chemotherapy, chemotherapy plus Herceptin, chemotherapy plus Herceptin plus Pertuzumab. There are two anti-HER2 drugs, Pertuzumab and Trastuzumab. When they are combined with chemotherapy or patients who are given only chemotherapy, only one of the drugs, the pathological response rate you can see in the second bar, like 45%. That is, every alternate patient got the complete response on the tumor sample taken out. So that is really good for if you get the complete response, that patient is going to live longer. And this indirectly will tell us how long they are going to survive. We can come. This is a disease-free survival. Though this trial was sample size around 400 and every 100 patients were across the trials, this is not powered for that conclusion. It will indirectly give us some of the patients are not getting the equal benefit. That is the future scope that we should take those patients who are at high risk of relapse, like larger tumors. Someone having bigger tumors needs definitely dual drugs, like dual anti-HER2 drugs. Someone having lymph node positivity, someone already spread to the disease spread to the axilla, they need this dual blockage to get a better outcome. And another similar study, Trifina study, which is also phase 2 study, and where they have taken 3 arms, all are experimental. Their primary endpoint is to assess whether any cardiac toxicity is increased when they have combined. This particular anti-HER2 drugs have a peculiar side effect like reversible cardiotoxicity. If you give one, they have risk of 1 to 3%. They just assesses this 1 to 3% has increased way beyond so that we cannot give to the patient. So they have given these 2 drugs with the different chemotherapy regimens and assessed whether they have increased cardiac toxicity. So this trial has proven that even if you combine these 2 drugs, which have a common toxicity like cardiac dysfunction, did not find much difference. So this is very safe to combine these 2 drugs to give the better response. So again, we see the secondary endpoint in this trial, like pathological complete response, reaching up to almost up to 66%. This is the PHTC, means Pertuzumab and Trastuzumab along with 2 chemo drugs. When they combine, the pathological complete response is 66%. In the previous study, we have seen 40% around because of number of cycles were less in the study. So we are almost every 2/3 of the patients are getting the complete response if you combine these 2 drugs with combination of chemotherapy. So this is another trial where last 2 trials which I have discussed in the Western population. This is particular trial which done in Asian population, especially Chinese and Philippines. These are all included because we have to test data in our ethnic population as well, where we can get the similar results or not. This is a phase 3 randomized study with a larger sample size, and given these 2 drugs together, Pertuzumab and Trastuzumab, and compared with the chemotherapy and single drug. So you can see the same main endpoint was to assess whether they are getting complete responses better than giving a single drug. So this trial also proved that the pathological complete responses are higher when you have given dual HER2 blockade, both Pertuzumab and Trastuzumab in combination of chemotherapy. And this trial was immature to conclude any decisions regarding the overall survival data or disease survival data. So some patients will get to the clinic after completion of surgery by some reasons, but patient preferences. And those patients, if they come out to be HER2 positive, what to be done? So once a patient comes to you at upfront to diagnosis, we advise neoadjuvant chemotherapy based on the HER2 status or triple negative status. But if the patients who are HER2 positive have completed and come to you for adjuvant therapy, so this particular trial is done in adjuvant setting, where again the adjuvant chemotherapy and single agent anti-HER2 drug was compared with chemotherapy plus 2 anti-HER2 drugs like Perjeta and Herceptin. And those patients were stratified according to the stage, the T stage and nodal stage, whether HER2 positive or not, hormone positive or not, and given 6 cycles of chemotherapy, along with anti-HER2 blockade.